Good day, viewers. I am Godfrey Brooms, and as you may notice, we're at the Ministry of Health, and soon we will be speaking with the subject minister, the Honorable Dr. Frank Anthony, for today's COVID-19 update. On today's program, we will be focusing on three areas. One, COVID-19 and the children, the increased number of persons taking the vaccines, that is both first and the second doses, and also of the planned shipment of another batch of vaccines, which is expected tomorrow. This will, of course, increase the amount of persons having access to vaccines and will also push the government's agenda of herd immunity. Let's now go and meet the minister. Minister Anthony, it's always a pleasure having you here on the program.
Well, thank you very much for having me on the program.
Minister, I understand that a shipment of vaccine is expected very soon. Is it the remaining Sinopharm vaccine or is it another?
Indeed, it is the remaining Sinopharm vaccines. As you know, the government of Guyana would have ordered 100,000 doses of Sinopharm vaccine. We received 88,000 doses.
All right, Minister, and of course this will further the government's wide agenda of having Guyana get to herd immunity.
Well, we're working towards that. These Sinopharm vaccines, with the 100,000 doses, will be able to fully immunize 50,000 persons. And so those that we have already received, we have been distributing that to the different regions. And these vaccines are much easier to handle because basically you can store them at between 2 to 8 degrees Celsius. Unlike the other vaccines that we've been working with, which requires very cold temperature. So in some of the more remote areas, our cold chain already caters for vaccines between 2 to 8, and therefore this would certainly help.
Minister, let's talk a little about children and COVID-19. A lot has not been spoken about this here. Are we seeing cases of children contracting the virus?
We do have children who would get COVID-19. A lot of time it's discovered accidentally because children generally would have very mild symptoms of COVID-19. In very exceptional cases, you might have some complications of those infections. So since the pandemic started in Guyana, we would have seen between the ages of, let's say, 1 month to 4 months, 4 years, we would have had about 287 children of that age, between that age group, being infected, 148 males and 139 females. And between the 5 to 9 year age group, we would have had 273 males and 251 females, which a total of 524 for that age category. And then between the ages of 10 to 14, we would have seen 342 males and 414 females, a total of 756 cases. So while most of the cases so far that we have seen have really been mild, over the last 2 weeks or so, we have seen a disturbing trend. And right now, in our hospitals, we have 4 children who have been severely affected by COVID. And so we are monitoring them, and hopefully the prognosis would be good because the medical team is really working to ensure that they can provide the best care for these children. So I think it's important that we take the necessary precautions, especially with our children, to make sure that they are protected they wear masks when it's necessary if they're going out, because the virus, as we can see, can affect children. And I don't think a lot of people have paid attention to that. And therefore, it's time that we pay some attention to this, especially now that we are seeing not just the mild cases in children, but we are seeing more severe forms of COVID among the children population. So I just want people to be, careful with their children and take all the necessary precautions. We have also seen complications when children get infected, and there's a syndrome that has been described that is called multiple system inflammatory syndrome, or for short, it's called MIS-C. And basically what you'll see is multi-organ failure, elevated markers and fever and so forth. We haven't really seen that in Guyana, but it's a complication of COVID when children get infected. But we continue to work, and as I said, the team is really working very closely with these 4 children that are currently hospitalized.
And Minister, as you rightfully said, that is most that we can do to protect the children, ensure that they wear masks, ensure that they wash their hands and sanitize, because there is no approved vaccines for children.
And more so also to keep distancing, because and prevent them from going out and mixing with people without masks and so forth. I think these are all important things that we should do for our children. And it also, if children are at home most of the time, then we also have to consider the interaction of adults who leave the home, go out to work, come back in. And if those adults are irresponsible and not taking the precautions, then they can bring that infection home. So it is something that I think people should be very mindful of, because you can bring that infection home and it can affect the children who are home, and also the elderly.
Minister, the 4 children are at one hospital?
3 of them are right now in the Ocean View facility, and we expect 1 more to come in very shortly.
All right, Minister, let's now focus our attention on the COVID-19 vaccination update. What is the overall number of vaccines administered to date?
As of yesterday, we have 234,255 persons with first dose vaccines. And again, that would represent 48.1% of our adult population. We want to encourage more people to come out and get their first dose vaccines. As I've said before, we have 3 vaccines that are available. We have the AstraZeneca, we have the Sinopharm vaccines, we also have Sputnik V vaccines first dose. And all of these vaccines are effective. First dose Sputnik V would give you up to 70-something% efficacy, which is very protective, protects you from going in the hospital and so forth. And we want people to take it because it is going to protect you and possibly save your life if you get, to prevent you from getting COVID in the first instance. And then even if you get infected, to maybe get it in a more milder form. But if you're without a vaccine, then you're putting yourself at risk. So all 3 of these vaccines are available, and we want to encourage people to come out and get their first dose. Second dose vaccines right now, we are at 112,371 persons who would have received their second dose vaccines, which would put us approximately at 23.1% of our adult population. And again, while a lot of persons would have received their first dose vaccines, those that have become eligible for their second dose, we'll want them to come and get those second dose. And that includes persons who would have gotten their AstraZeneca vaccine and their Sinopharm vaccines. So once you're eligible for your second dose, please come and get it. In terms of Sputnik V, we are working to get the second dose of the vaccine in, and we are working very hard to see how we can source these vaccines and bring them in. Working with the suppliers, trying to confirm the dates. But as you know, these vaccines can be administered from 4 weeks right up to 12 weeks. And most of the people who would have received their first dose Sputnik V, while they're going to become due maybe in another month or so, we want to make sure that we have these vaccines in before that to ensure that people can get their second doses on time.
Thank you, Minister. We know also that in some hinterland regions, there were some accessibility issue in getting the vaccines to these people because of the heavy rainfalls which led to flooding. How are they now, and have there been any improvements?
Well, as the water recedes, we are going to send back our teams into those communities. Part of the challenge for some of those hard-to-reach community, if we fly teams in and it rained, then the plane can't go back to pick them up. So that has posed all kinds of challenges for us, because when you take some of the vaccines out, you have to maintain a cold chain, and therefore every 2 to 3 days you have to replenish the ice that they're using to keep the vaccines cold. So for some of those areas, we had to temporarily stop our operations and wait for the water to recede. But now that most of the places the water is receding, then we'll be able to resume the vaccination process.
Heart Minister, surfacing on social media, popular right now, is that receiving a COVID-19 vaccine will cause you to be magnetic.
Well, certainly that's a myth, because the way that the vaccines are made, it's really biological and some chemical material that is there to stimulate your immune system. And it's really geared to make sure that your body, your immune system, respond by producing antibodies to fight off the virus. There's nothing magnetic about that. And if you don't believe and you're fully vaccinated, just get something metallic and try to see whether it will stick to you. It's not going to happen. And, so people, the long and short of this is that they're a small group of people who probably hate vaccines. And for whatever reason why they hate these vaccines, they are peddling all kinds of false information, not science-based, it's just false information. And because some people are not very discerning, they tend to believe these rumors and fake information. And that can be very detrimental, because if people believe these myths, then it's going to make them hesitant. It's going to confuse them. It's going to make them hesitant about taking the vaccine. And undoing that damage that was done by the false information would take a lot more effort. Because if somebody believed this, it's going to be harder for you to dispel that belief. And in some cases, that is what we are fighting, because these things spread all over the place on social media, and you don't know what people are reading. And unless you talk to them, and some of these things, like it makes somebody magnetic and so forth, as we find them out, we try to dispel them. But I think sometimes people got to use their common sense. Take a step back and think about it and see whether this makes sense or not.
On that point, we also found on Facebook making the rounds is that persons with certain blood types have less severe COVID-19 infections, so it's not necessary to take the vaccine.
And there's no science in that either. So regardless of your blood type, you're at risk for the infection if you're not vaccinated. So again, there's a very simple scientific explanation, and I hope people would use their common sense, think through these things, and don't get fooled by people who are going to put your life at risk with fake information. Don't believe the fake information that is out there. If you want to get proper information, go to the science-based websites. You have quite a few of them around the world. So in the United States, the Center for Disease Control is a very reputable website that one can go to and get a lot of COVID information. The World Health Organization has a whole section on its website that deals with myths and myth busting, so people can go there and access factual information. And of course, there are other reputable sites that one can find. So I would encourage people, rather than listening to these fake news, if you have a doubt, go to one of these reputable websites and look up these matters. And I'm sure you would find information there that can dispel those doubts.
There you have it from the Minister of Health, the Honorable Dr. Frank Anthony. This has been the COVID-19 update. For more information, you can visit our website at dpi.gov.gy and our social media platforms. Godfrey Brooms is saying goodbye for now.